Meininger. I'm an internist and a pediatrician. I do have some prepared remarks that I brought a couple copies of, but I want to echo what a couple people have said. First of all, the mental health piece. Before I joined Gillette Children's, I was at 2 community health centers, and as Stella said, you know, really the community health centers aren't being funded at the level. They've had flat funding for a number of years. They are the safety net, and we're getting holes in the safety net. I was at Community University Healthcare Center in Minneapolis, where we serve patients in 7 different languages. So working with a lot of the refugees and immigrants, we have staff interpreters on site. I teach the interpreter course at the U, so I'm going to bring the thing about the hyena to make sure that that mistake never happens again, at least with some of the new interpreters. But the mental health piece as well. I'm a primary care doctor. I was out in Stillwater at the only community health center, which is part of Southside Community Health Services. We're the only clinic in Stillwater that's sliding scale. 70% of our patients didn't have insurance that we're working for, and part of that is because of the cuts that we've had to make at the state level with Medicaid and its qualifying levels. If you work even a job that will barely cover the cost of housing, you no longer qualify for Medicaid. So I think that's a really key thing as well. But the main reason I'm here today is as a board member of the Rainbow Health Initiative to make sure that we don't forget about the needs of my community in this dialogue. I noticed that the roundtable was pitched as a conversation to discuss health disparities in communities of color. And I come to remind all of us that lesbian, gay, bisexual, transgender people are also members of every racial and ethnic demographic. Effects of health disparities faced by LGBT people of color leave them vulnerable to the cumulative negative outcomes. Senator, there's 3 things that I would really ask you to remember when you return to Washington. First, we're hidden, we're not seen, or we're systematically ignored. Any healthcare reform needs to fully be LGBT inclusive. Second, we're disproportionately unable to get our health needs met. We need guaranteed access to healthcare. And third, we really must mandate cultural competency if we're to fully address the issue of disparities. Let me speak to each of these very briefly. First, we hide because of sanctions against us in many states and widespread discrimination against us. More so, we're hidden because of the data issue that we've already discussed. There are no national survey data that provide accurate figures documenting the health of our community. And the census is really going to be one of the first that attempts to even quantify the size of our community in 2020. Second, many employers don't extend coverage to our spouses and our children. The interpretation of family, parent, and spouse commonly excludes our families because we cannot access the rights and benefits of legal marriage. If that weren't enough, Governor Ventura extended domestic partner benefits to state workers, families, and then Governor Pawlenty turned around and took it away. The insurance industry and even the Minnesota legislature systematically denies necessary health care for my transgender brothers and sisters. We need protection at the federal level from this type of discrimination to our community. And then lastly, providers in the healthcare system must fully understand and embrace cultural competency. Universal access to healthcare has little meaning if we cannot get it from people who recognize and affirm our identities. We have some excellent professionals here in Minnesota, but the fact remains that 40% of LGBT Minnesotans have not disclosed their sexual orientation or gender identity to their healthcare provider. So to summarize, healthcare reform needs to be fully LGBT inclusive. We need guaranteed access to healthcare, and we need the universal implementation of cultural competency. And Senator Franken, I remember when you and Franny came to my church, the gay church, when you were campaigning, and I know that my community supported you in your efforts. I hope that you won't forget us when you go back to Washington. Thank you.
Thank you very much. Senator Franken, thank you for inviting myself to this important meeting. I really appreciate this. Again, my name is Dr. Pat Rock, CEO of the Indian Health Board. Actually, it's the oldest, the very first urban Indian program in the United States. This is really the nidus where Minneapolis was the nidus where urban Indian health movement started. I'm very proud of that fact. I'm also the president of the National Council of Urban Indian Health. So it's a coalition of 34 urban Indian health programs across the United States. And what I have to say is basically we see immigrants the immigrants are from Red Lake. The immigrants are from White Earth. And that's one of the past relocation practices of the United States government back in the 1960s to forcibly force people to urban centers, such as here in Minneapolis. And we see it. I'm still a practicing physician. A good part of my time, I still put hands on people, still carry a stethoscope. Been doing that for 12 years now. I've complained enough, and that's probably why the position I'm in right now is people continue moving up the ladder in my organization as well as nationally also. But one of the things I think, one thing that we need support is look past practices of the previous administration when they zeroed us out. They completely zeroed our program out. And we move forward from that. And we actually want to advocate for potentially a larger line item. I hate to say this, but we have my people, almost prefer to be a prisoner because you get better health care. Per capita cost per health care is better if you're a prisoner than if you're a Native American living in the Twin Cities area, which is a crying shame. Even despite ARA and the $500 million that was injected into the Indian Health Service, urban programs saw $0 from that. Absolutely not. And I'm not advocating stealing from Peter to give to Paul, but I think it just needs to be more supportive language for the urban programs that are in existence. And also support the Indian Health Care Improvement Act, Title V specifically. We see it every day. I see folks, 40% of what we see are uninsured people who've lost their jobs, people who have really nowhere else to go, and often have their health disparity issues, such as diabetes, have gotten to a degree that they're suffering complications because they couldn't afford to go to the doctor, despite having FQHCs around, despite having clinics that will see you and often see you for free, but folks are still suffering these issues. I'm seeing them on a daily basis. So just from a personal standpoint, I'm very happy to see you in the seat that you're in. I want to offer my support, if anything I can do for you, support any kind of language. We do have epidemiological evidence. If that's what you need to support some language, stronger language in the Indian Health Care Improvement Act. We have that through the Seattle Indian Health Board. They have an epidemiological center that studies 34 programs. We accumulate data to support our programs. And I also would like to extend a personal invitation to the Indian Health Board of Minneapolis. If you ever want to come by and see our programming, we'd be more than happy to invite you and be an honored guest at our facility. Thank you.
Thank you. I'd love to talk to you about the Indian Health Service too. I know that's more reservations and that kind of thing, but my concern I've seen resistance to increase funding because of dysfunction within the Bureau and the Indian Health Service. I want to make sure that excuse isn't valid, and that we make sure it's in it.
I think there's strong leadership now in the Indian Health Service. Dr. Yvette Robideau, a personal colleague of mine.
On suicide.
Yes.
She's as good as we've seen in a long time. So.
Yes.
And I just want to mention too that Senator Dorgan who's the head of the Indian Affairs Committee, is introducing the Indian Health Care Improvement Act as an amendment to health reform, and will be working hard to support those efforts.
Again, anything I can do to help you information-wise, I'd be